Hey guys, my name is Ted Bessemer. I'm a physical therapist and strength coach. I'd like to introduce you to something I believe you and your athletes may really enjoy and benefit from. It's called AXIO centripetal training. Now, AXIO is great for overhead athletes and ball players because it provides a unique combination of strength, endurance, proprioception, and neuromuscular benefit that is really unparalleled to traditional training methods and manual techniques. I created AXIO to avoid needing surgery after tearing my labrum and rotator cuff several years ago, but I also wanted something that would be progressively challenging, that provided enough resistance and also elite level neuromuscular control to improve performance. Now, AXIO does exactly that. Inside an AXIO trainer, there's anywhere from 1 to 3 weighted steel spheres in a resisted channel. It uses rotational resistance or centripetal force to provide a complete 360 degrees of resistance. Now, what this does is it engages multiple muscle groups at the same time. So it lights up your entire rotator cuff just with one movement. It automatically engages your scapula, stabilizes your core, and depending on body position, it can get lower extremity, hip, ankle, really a very versatile integrated tool. Now, AXIO is great for warm-up. We have our AXIO 8 throwers routine, which is a quick 5-minute comprehensive routine for pre-throwing. AXIO is also excellent as a tool to integrate into your training program. So your traditional workouts, AXIO can be used along with when you're doing your traditional core exercises, any movement, virtually endless ways to use AXIO in your workouts. And then finally, it's an excellent tool for recovery. It's minimally compressive, decreases congestion in joints, muscles, soft tissues, and improves capillary refill. So a very versatile tool that does a lot for our athletes. So if you have any questions, please feel free to reach out. My contact information is below. Look forward to hearing from you. Thanks so much.
Hi everyone, my name is Steve Thomas. I'm an associate professor and department chair of the Department of Exercise Science at Thomas Jefferson University in Philadelphia, Pennsylvania. So my research centers on studying chronic adaptations in baseball players, really centered around injury, but as we know, preventing injuries and maximizing performance really go hand in hand. So the research I do, one aspect of it is studying the neuromuscular control adaptations in baseball players. And this is one thing that I see very commonly, and a big reason why baseball players often get hurt is because they have neuromuscular control deficits. And it's not just at their shoulder, scapular area, it's throughout their whole body. So within baseball players, this is a big challenge of how do we train the neuromuscular system to function appropriately? How do we get it back to a healthy state? And one tool that has recently come out that I'm really enjoying, and I'm seeing more and more how applicable it is in baseball and how important it is for baseball players, is AXIO centripetal training. So it's a really useful tool. I think it's going to really enhance performance in addition to keeping athletes healthy. But I truly believe this is a device that has great use for baseball players. I really think it's going to help a lot of players stay healthy and stay on peak performance moving forward, and hopefully prevent a lot of the injuries that we see in baseball. So check it out, try it out, get your hands on it. It's tough to describe until you really feel it, but you're not going to be disappointed. Thank you.
Might be one of my favorite products, AXIO 360. Basically, it's like a shoulder tube on steroids, honestly. It's got a ball, and you got to roll that ball around, and you just stabilize here, and you can kind of go in different directions. But I've been using it for my rehab, coming back from surgery, and it's pretty dang sweet.
AXIO is an all-around stellar training device. It fits in your bag, it's the best arm care training device, and it's going to be incorporated into all kinds of regimens here in the near future.